everyone. So I'm going to be going over the veins part in the Introduction to Thoracic Wall lecture. So we're going to start from this point. We have the musculophrenic vein and the superior epigastric vein. They will join to form the internal thoracic vein. And in the same time, I have the anterior intercostal veins, which are also draining into the same internal thoracic vein, which is moving upwards, and the internal thoracic vein will drain into the brachiocephalic vein. The brachiocephalic vein is actually formed by the connection or the junction of subclavian and the jugular vein. They form the brachiocephalic vein, which eventually drains into superior vena cava. So just to recap, musculophrenic, superior epigastric, they join to form internal thoracic. In the same time, I have anterior intercostal veins also draining into the internal thoracic, which will drain into brachiocephalic, and this will go to superior vena cava and to the right atrium. This is happening anteriorly. If I'm gonna look at the posterior side, I have posterior intercostal veins from the right side and the left side. The right will drain into something called azygos vein. The left will drain into something called hemiazygos vein. Now, azygos vein is one vein, but the hemiazygos is actually divided into two, like this. So in some books, they call it the top one. It's called accessory hemiazygos vein. And in some books, they call it superior and then inferior. So here we have hemiazygos vein and accessory in this photo, but in other books, they can call it as superior and inferior. And those hemiazygos veins, they will collect, like the left posterior intercostal veins will drain into them, and the right posterior intercostal veins will drain into the normal azygos vein. Hemiazygos will drain into the azygos, and the azygos will then go and drain into the superior vena cava. And then we have one exception, which is the left superior intercostal vein, because this will drain immediately into the brachiocephalic. It will not go to the azygos and hemiazygos and then go to the superior vena cava. No, it will go by itself to the brachiocephalic. And that's it for the veins.